The ongoing debate surrounding the origin of the second wave of the COVID-19 virus has swept over the island. Fingers have been pointed at both the back and front door. Many have remained skeptical of both narratives, and now officials say they cannot say conclusively that any of the cases were linked to illegal entry.
Can you state categorically that no other visitor has presented a COVID-positive diagnosis between then and now?
As far as I know, it's one visitor we had who came in positive. We did the contact tracing at that hotel, and we did not get any transmission coming out of that hotel.
All right. Okay, well, I'll go. This is my last one. So, officially, has the Ministry of Health or your office identified any link to the illegal or backdoor entry to the current outbreak? Has there any link conclusively to say, well, an illegal entrant has stimulated, for lack of a better word, the community outbreak?
Yeah, I think I will let Dr. Gomez speak of what epidemiological links are, okay, and the conclusive link you're asking for. I don't think we do that conclusive link. You have to show that the virus went from one person to another. What we do is epidemiological links, not the links that you're asking about. And we have been able to establish a number of epidemiological links. Maybe I'll allow Dr. Gomez to speak to what we mean when we say epidemiological links.
The chief medical officer puts the major threats to the island's management of the virus into perspective.
Our four main risks. One is the high risk in the international arena. The risk by illegal entry in the border, also the breaches to home quarantine, and that is both for persons coming in who are granted home quarantine and persons who are given home quarantine based on their status through contact tracing.
Officials are trying to identify the origin of the second wave. However, Dr. Belmar George says authorities have observed non-compliance with those placed in home quarantine. Health officials are awaiting the arrival of wristband monitoring devices to aid in effective home quarantine. The shipment has a tentative arrival time of 2 weeks.
Our reality is, as we contact trace, it is very difficult for us to accommodate everyone. At this point, we are monitoring over 700 people. So it's difficult for us to keep 700 people within an institution, and those numbers will continue to grow. So we continue to work at the level of the communities. We continue to advocate, and we need the cooperation. We need the support of everyone who knows persons in quarantine to ask them to adhere. As well, if you know someone is in quarantine, it's not the time to visit them. And we see that happening at the level of the community. We even had someone in quarantine hosting a party, and persons came. So these are some of the irresponsible behaviors leading to the high reproductive rate we are seeing within the second wave.
On Tuesday, the island recorded 6 new cases of COVID-19, bringing the total as of Wednesday afternoon to 148. The contact tracing team of the Ministry of Health has thus far been unable to establish an epidemiological link for these 6 cases. Case number 143 was the island's first COVID-19 death. Solange Alfred, HTS News Force.